Okay, so the topic we're discussing this week is aging in the immune system and how it responds to the body as it does its aging process and how it responds to infections and things like that. Although some immune responses are diminished with age, others do not undergo any changes. Sometimes, as a person ages, the immune system becomes sluggish in response. Signs that an elderly person may have an immune deficiency are repeated infections or prolonged infections and digestive problems because the digestive tract becomes sluggish and doesn't process things the way that it's supposed to. And so elderly individuals have problems with constipation and urinary tract infections and such things like that. Neutrophils are one of the things that diminish in ability with aging. Neutrophils are main objective is to fight bacteria and fungus in the body. And when a person ages, the neutrophils become sluggish and can't respond in an efficient amount of time. So it gets like infections the ability to harbor in the body more easily and stay active more long for a longer period of time. T cells and B cells, which are one of the immune responses, um, they're one of the main things that fight infections and cancer and things like that in the body and certain diseases. And T cells don't necessarily decrease in number by aging, but their function decreases, which makes fighting infections harder for the elderly to get established on that. B cells, however, they do decrease in number production with age, so this also weakens the immune response to be able to fight inflammation or infection. This also results in a higher likelihood of contracting diseases, and this makes it more likely for things like cancer to inhibit the elderly and chronic diseases to take effect, and your body can't fight them as efficiently as it normally does when it's younger. So with elderly people, you really want to make sure that you stay on top of things and get them on antibiotics and certain things quicker so the body doesn't have to use as much of its resources to try and fight those infections. And you really want to take like chronic illnesses like diabetes and things like that. You really want to stay on top of them and keep them controlled because the body can't respond effectively in the elderly like it needs to. And so things have a tendency to get out of hand more rapidly than they would in a younger individual. So staying on top of things is very important. Thanks.